Nearly 2,300 years ago, Hippocrates declared that food should be our medicine and medicine should be our food. And now, after a rash of wonder drugs that didn't turn out to be such wonders after all, in modern times, I think there's more interest in looking at that ancient teaching, and we are seeing in ourselves results and positive results from our experiments in comparing ancient KAMUT, Khorasan wheat, with modern wheat that we are eating every day. Cardiovascular disease study was actually a study comparing KAMUT Khorasan wheat with modern wheat, both organically grown, in subjects who tested a replacement diet, and for the purpose of comparing response to symptoms of acute coronary syndrome. The reason we chose a cardiovascular disease study was because of results we had seen in a previous study of healthy individuals who had certain risk factors for cardiovascular disease but had never had a heart attack or another incident. And because we saw some interesting responses to those risk factors, we thought it would be very interesting to look at cardio disease patients who actually had had a heart attack or some other serious event related to cardiovascular disease. One of the things that was not told to me before we started was that the doctors really believed there would be no significant difference between the two diets, because all of these individuals were on a series, some up to 8 different drugs, which were treating their condition of cardiovascular disease, which was quite serious. One had had at least 3 heart attacks. And because of the drugs, statins and other drugs used to treat such a disease, the doctors felt there'd be nothing to see. The big surprise to all of us was that there was a significant difference in every single aspect that they looked at between ancient KAMUT Khorasan wheat and modern wheat. We were very careful in the study to try to limit the variables to only the diet. So people were asked not to make any changes in their lifestyle. If they were smoking, they were not asked to quit smoking. If they were sedentary, they were asked not to start a big exercise program or stop an exercise program if they were involved with that. So we had, as much as possible, only the variable of the diet. When we looked at the results, we saw, for example, glucose levels decrease in the blood. We saw insulin decrease. We saw magnesium increase. We saw the cytokines, which are indicators of anti-inflammatory properties, greatly increased, while the inflammatory property ones decreased with the ancient grain. And we saw very little or no effect with the modern wheat diet. I think it is really impossible to pinpoint one item that's different with KAMUT brand Khorasan wheat compared to modern wheat. We think it's a synergy of many different compounds and effects on the body.